Hi, Dr. Shannon. Very pleased to have you here at the Erotology Institute. I'm an avid fan you are a sexual health expert, licensed psychologist, and a certified sex therapist, amongst other things. So I wanted to introduce our students to your fabulous work and to get a little bit to get to know you a bit about your background, how you started, and how you became a sexual health expert, and also some of the resources that you offer, if you don't mind. So again, thank you again for taking the time to speak to me. But just by way of background, do you mind giving us a little bit of a background in terms of who you are and how you became a sexual health expert and a licensed psychologist?
Absolutely. Well, first of all, thanks for having me. Congratulations on the Institute. It's such an important thing to have a place of learning and a space and community for people to do this work. And that's kind of what brought me to this field. I grew up in a conservative family. I knew from a very young age that sex was something that people were uncomfortable talking about. But I saw it as this thing that we all had in common. I was a very curious child around sexuality. What is this thing that we're not even allowed to say the word in my home? So as I started to, get into my studies and understand a bit more, I realized that sexual healing is relational healing. And it doesn't matter if you are in a relationship or single or just really trying to find yourself and purpose. This is an integrated part of our entire being. So to me, it felt like a given, of course we need to help people with sexual healing. And because it was something I was comfortable talking about, but also realized there were a lot of people like me, conservative families, a lot of shame around sex. I knew that it was a perfect niche for me. So it was also something that keeps me on my toes. I'm always learning in this field. I love the field of sexuality because it doesn't matter if you've been doing this work for a long time or not. There's so much to learn. There's so much for us to accept and be open to, a lot of diversity. So I love this field. It's always keeping me on the edge of my seat and learning and helping people through my practice. So that is what I do now. I have a private practice here in California, but I also work with people worldwide in the field of coaching and consultation. So lots of different services for people that are looking to find their healing around sexuality.
Well, and that leads me to my first questions, or my second question, shall I say, sorry, because you mentioned you do a bit of coaching as well. So just for the benefit of our students, what is the difference between sex therapy and sex coaching? Because obviously you do both. And so yeah, I'm just wondering, first actually, what is a sex therapist? What is a sex coach? And what is the difference between the two?
Yes, great question. Because I always tell people sexual concerns don't always need therapy. In fact, a lot of our concerns around sexuality, which can be physiological or psychological, really depending on the issue, coaching can be a great modality. So, coaching is more solution focused, it is more short term. It may be somebody coming in looking for some recommendations or resources. A lot of my coaching clients are actually doing quite well in their intimate life. And they may just need a little bit of guidance, maybe looking for some things to enhance or explore, where therapy is more of an in-depth relationship that you build in the therapeutic environment. We may be looking more at background. We're going to look at attachment and early upbringing. We're really the influence of culture of all aspects, our individual culture and our societal culture, and how that shapes the way we think, the way we behave, the way we function around our sexuality. There's a lot of relational healing in therapy. So my style of therapy, I use more mindfulness-based cognitive work. I use a lot of psychodynamic work, really getting into the things we tell ourselves, our belief systems. So it is more of a long-term type of work. I always say, if you're not looking to build that relationship in therapy and really dedicate the time and commitment, coaching is probably a better option. Therapy is definitely something that requires either a weekly or every other week cadence, and we're really coming in and we're doing a lot of deep diving. Where coaching, it may be, I need some advice on what type of pleasure devices to use, or I just had a baby and I would love some help and support around postpartum care. So it's very specific and goal-oriented, where therapy may be, I feel blocked. I'm not sure where to start. I don't know what my concern is, but I know that I'm feeling a lot of distress and I would love some guidance and help. So I would say therapy and coaching are both collaborative. My approach absolutely is. I think of us as a team. We're not, one of us is not just giving advice and guidance. It's really about building that relationship together.
Lovely, thank you. Because one of the questions that I often get asked, and obviously I'm not a therapist, but I try to make people in the right direction to people like yourself is when people ask, okay, I might need therapy, or how would I know? Or so I'm just wondering is, and you did mention that it's not only for people that are in relationships, also people that are not in relationships. So I imagine if, for
Yes.
example, someone who is not in a relationship, but they might have some limited or negative self-talk or limited belief systems, is that something that therapy will can you can help someone kind of address some of those concerns? Because again, that's also a number of the questions that I get is that people are worried, especially women, before getting married or into a relationship. A lot of like negative self-talk or limited belief systems that is kind of excruciating for them. So is that something that it's a good time to go to therapy, or would you say when you get into relationship or when you have concerns with your partner, when is the best time?
Actually, I think what you just described, coming in before you get into the relationship, because the relationship with yourself is an integral part of our sexuality. It's so personal. Everyone's sexuality is so different. So I think a lot of people feel very isolated. Or am I normal because I'm going through this? So a lot of the therapeutic alliance starts with normalizing the fact that we are all very different in our sexuality. And so learning those tools, whatever it may be, your own insight, understanding how your body works, overcoming some issues around confidence or sexual self-esteem, building that toolbox before you get into a relationship is going to reduce and prevent sexual concerns later on in the relationship. So it also gives you a lot of insight and awareness into general things that we don't learn. And why I think a lot of people should start individually in therapy is that most of us had very poor sex education, if not, if any at all. I mean, most of my clients that I'm working with will say, I might have taken a class here and there in school. My parents never talked to me. So therapy is also a place where we learn a lot about our sexuality. And that's what I love about the model that I provide. We're doing therapy, but we're also doing a lot of education, adult education. So it's not a place to come in and feel shame because I don't know all these things, or, I'm this age and I should know this by now. It's really meant for adults to learn intimacy in all avenues, not just romantic intimacy, but also social environment. How are your social skills when it comes to community and meeting friends and self-expression? So there's a lot of great skills that can be learned even as an individual.
Lovely, lovely. And you mentioned the model. Is that the mind-body approach that I've seen on your website? I'm just wondering if you could talk a little bit about what that entails and how that helps. What's the correct word? Sorry, is it clients, patients? 'Cause that's what I wanted to know. Like, people that come to see. What is the what was a politically correct term to use?
Question. Great question. We hear both in the field. I always felt
Okay,
patient was very medical model, and I
that's what I
like
said.
to
Yeah.
think of client as more empowering and collaborative. A client coming in, we're working together, and as a patient, I think it sort of implies that we're resolving something that's clinically wrong. And I think for a lot of people, I want in a very empowering environment. I want you to come in, even if you don't know where to start. Best place to start is not knowing where to start. So having, a foundation, and I think client is sort of helpful for giving them the sense of, feeling empowered and having control over the process.
Yeah, I prefer a client as well. Yeah, so sorry, so a client is coming to see you. How would what does the mind body is it model approach? What does that entail?
Yes, it actually developed. I was working with a GYN in my first practice, and so we were really covering all bases, psychological as well as physiological. And when I started my private practice, I found that most people are either addressing one or the other, but not both simultaneously. So I wanted to take a holistic approach, even to general mental health. If we are dealing with things like depression and anxiety and not looking at gut health or what you're putting in your body or how you're sleeping or your lifestyle choices, then I think we're really missing a big piece of understanding the holistic relationship to the body. So my body to me is looking at every aspect of functioning, not just psychological, but looking at how does our psychological affect our body and how do the two communicate? How do we want to work with the body and the mind to better understand how you can feel more in control of your behavior or what's going on. And, learning about some of the functions that come along with pleasure and play. So to me, it feels very intuitive to take a holistic approach, but I know my field is still a little bit, we have a little bit of a lag as in far as, coming into this world of more mind, body, and holistic work. What's great is we're seeing a lot more of that now, whether it's somatic interventions, especially with things like trauma, and we're working with the nervous system. There's so much that we can't see or know unless we really get into the story of the body. So that's kind of the exciting part of working in that type of approach, is we look at all aspects of what's going on physically, emotionally, psychologically, and even spiritually in terms of purpose and drive, and what are the things that motivate you in your life.
Thank you. Lovely. You mentioned a couple of terms, and one of the things that I've noticed is people will either diagnose themselves or diagnose like their friends. So you hear words like um, trauma, narcissist banded about quite frequently. Now, are these I don't know, is it medical terms? Are they psychological? Like, can anyone like name or like diagnose someone with some of these things, whether it's we will talk a little bit about addiction a bit later, but I'm just wondering, how do you deal with those challenges where someone might feel, oh, I'm a narcissist, or I've got trauma. Would the person be able to know themselves, or would they need to go to a professional like yourself to help diagnose them if they have one of these? I don't know if the correct word now is it called a mental disorder? Is it an illness? Is it, how would you, I don't know, sorry, the correct terms in terms of these
Yes, that's a great question, because I think there's a lot of evolution happening even in the world of psychiatric medicine. So that's where a lot of these diagnoses come from, is the psychiatric side of the field of psychology. And that can be very limiting. So I always look at diagnoses as a starting point, especially if someone is finding a diagnosis that connects and validates their experience. So that's important, because that's a starting point, but I do think it's important to work with a professional and assess what those symptoms are like. What do they do, and how do they change? And is it constant? I also find that a lot of the diagnoses are a little bit scary and overwhelming, especially the sexual diagnoses, these big scary words like anorgasmia or hypoactive sexual desire disorder. And they can do more harm than good, especially in creating a lot of shame and feeling broken. And the reality is we all have sexual concerns. So whether you have a diagnosis or not, there's a lot that's happening and that's going to happen over our lifespan. So diagnoses can help, but I don't think that they're an end-all treatment point for any of us. I think that we can use that as a guide to find ways to build skills or resilience coping mechanisms, things that can help the client be more in control of their mental health. But also, I think that we don't want to get too caught up on the labels, because then we can get stuck there. We start identifying with the label rather than feeling like, "Yeah, I'm just a person who sometimes deals with low desire," rather than, this is what I am and this is what I will carry with me in terms of my sexual identity. So I think they can be sometimes problematic in that way. And then I would say the one thing, based on what you mentioned with addiction, is there's a lot of there's not a lot of agreement even in the field in terms of how we call it. Some people say it's definitely addiction. Others will say it's a compulsive behavior. In my field, we call it out of control sexual behavior. So if there's not a lot of consensus even in the field, it's even harder for a client who's looking for help or guidance on how to treat a specific concern. So I think that's where sometimes labels or diagnoses can be limiting.
thank you. Since you mentioned addiction, we might as well get into that, because I had a couple of questions around your great work you've done on love addiction. Or is it out of control? Is it what is the appropriate term? Is it compulsive sexual behavior, intimate behavior? Is it love addiction? The reason why I'm asking is because oftentimes I hear people saying, my partner's a porn addict, or they think they're a sex addict. And I'm just wondering, is that a helpful term to use? Or, well, I find it on two ways, where sometimes someone, usually a woman, will um accuse their partner, usually obviously a man, of being a porn or sex addict, or maybe them, or sometimes the man might say it to kind of like a way of not taking responsibility. So maybe he's had an affair, he's cheated, and said, "Oh, I'm a sex addict. It's out of my control." So with things like that, is that
Right.
can you diagnose yourself that way, or do you need, or is it better that someone is obviously sees a professional like yourself to be diagnosed? Because that's yeah. Sorry, I just wanted to like, how would you know who is a love addict or sex addict? And are the two the same or are they different?
That's a great question. I mean, in our society, we love to put addict after everything, right? Food addict, exercise, work addict. And I think that for some people, they can understand by using that term addict that there's something in my life that's claimed my consciousness. And that is my starting point of finding some ways to get help. Now, a lot of people that might have addiction may not have the same level of distress as someone who's actually seeking help. And I would say that is our biggest difference between what might be just healthy high desire for some people or people that are enjoying, the entertainment of pornography versus someone who has now hit a level where it's out of control. And there are certain levels that we're looking at in that assessment. So obviously, if there's a level of distress, the person's not able to stop using despite all efforts. There's negative consequences. It's impacting every relationship in their life. And that's usually what I'm looking at with a compulsivity or out of control behavior. It surpassed their ability to stop it, to address it, and now they're seeking some guidance around that. The problem with the term addiction is that it uses an addiction model, and that's the chemical dependency model that's just been applied to process behaviors or things like sex. And what I had an issue with when I was doing my research is, can we really be addicted to this thing called sex? And what is sex? Or what are we calling sex? So in my research, I kind of broke it down into love, relationships, and sexual behavior. And yes, it can be out of control. There's definitely things that can escalate in that behavior, or we can start out with certain seeking of behavior, but then it escalates. And it does have a similar tolerance or withdrawal, which we might see with chemical dependency, but there's no real takeover of our brain chemistry. Again, anything can claim our consciousness. So I would say smartphones are just as problematic as pornography or love and sexual behaviors, because there's a reason why we're using that material. And that's usually what I'm looking at in my assessment is why are you using the pornography? Is it an escape? Does it help you deal with stress or anxiety? So I try to kind of look at the underlying driver rather than say the sex or porn is the problem. Usually it's that becomes a way to cope with what the problem actually is. So that's why I think sometimes porn gets a bad rap. We blame porn for all the problems around compulsivity, but it's really how the individual is using that material to cope with something that's not that they're not able to cope with anymore. So there's sometimes I have a lot of compassion for those individuals because they have tried other methods and they've gone to something that is, I call porn, it's anonymous, it's accessible, and it's easy to access. So it makes sense that it would be something that people are using to cope with more regularly.
No, I love that. I'm glad you said that because that's something that I've noticed is that people always, like for example, with porn, will blame porn rather than trying to understand the underlying reasons of why the person may be watching or feels like it's out of control while they're watching a porn. And that's a whole different conversation to have rather than just blaming porn and saying if we get rid of porn, there'll be no issues or whatever that person's dealing with. So, and I've actually noticed because I saw I don't know if it was an interview with, I can't remember the gentleman's name. He wrote The Myth of Sex Addiction. And he was arguing that
Dr.
because
David Lay, he's a,
Dr. David Lay,
yeah.
that's yeah, definitely, yeah, David Lay, sorry. He was arguing that number of, and I've seen this in my experience as well, that a number of people of religion, like whether they are, pastors, priests, imams, will kind of use like sex addiction or porn addiction, oftentimes without scientific backing, to kind of always demonize anyone who maybe has some what they might consider out of control behavior or any behavior that's outside of like the acceptable norms of their religion. And he was just talking about how this oftentimes one of the challenges is that especially maybe like religious or conservative communities, there's a lot of shame attached towards like sex addiction and porn addiction without actually trying to understand why the person may have this problem, if you want to call it a problem, or this out of control behavior, rather than just demonizing whether it's like the profession of the adult industry or someone having extramarital relations or what have you. So I'm glad what you said about trying to understand the underlying problem because a challenge that I'm having when I'm trying to find other than yourself. I'm glad you said that people who are specialized in like sex addiction or porn addiction, it's always just demonize porn and it's the porn is the devil and blah blah blah. And it's like what rather than like you mentioned, trying to understand maybe like some of the underlying reasons why they feel that we consumed watching porn. And would you the therapy that you give for a partner of a porn addict or sex addict, would you usually give that to the couple together or would that be separately? I'm just wondering, like, in terms of the messaging, would it be separately? Because usually the partners that I've come across, we thinking they've been betrayed and they're trying to understand what is. So I'm just wondering, would the approach be different for the sex addict, if we can call the person that for now, and then the partner of the sex addict?
Yes, I usually do it in stages. So the first stage would be to stabilize the partner that has had the betrayal. So there is a major psychological trauma with the discovery or disclosure. So in that first stage, it's helping to provide a resource of understanding, what is actually going on? Because oftentimes there's not even a lot of background and there's so much discovery and maybe a partner has said, I'm an addict and here's what's going on. And there's so much confusion and shock around it. So working with partner first, and then when the partner has a little bit of footing and grounding, be able to recommend couples therapy together. And the purpose of that couples therapy is not just to allow the person that has betrayed the partner to be validated in the fact that they have this out of control behavior, but it's the opposite. It's to validate the partner in that the experience that the partner has gone through, the trauma that has been caused as a result of the behavior, and even the disconnect from that person's individual sense of intuition, which is, I knew something was wrong, but I was ignoring those feelings. So having an opportunity in couples work to do a lot of repair for where that trust has been breached. Sometimes the shattering of reality, because everything you thought is no longer. So there's a lot of rupture to the relationship. And so that's definitely a secondary phase, but I would recommend, individual support first, because that's absolutely important before bringing it into the dynamic of the couple.
Right. And if someone, I know you're based in the US, but most of my students or clients are outside of the US. So do you take international clients or would the people need to come in person to your clinic? Do you do like online? Like, I'm just wondering, just for people to know.
That's a great question, because a lot of people in their area, there are no resources. So they may not
Mm.
have, certified sex therapists or sex addiction specialists. So what I usually provide is consultation or coaching for international clients. And that at least gives us a basis of where to start, what to address first, maybe even some resources or readings that can help to provide a base of support for that individual or couple. So absolutely. And a lot of my consultations are just, where do I start? What do I go through first? What would help me better understand what's happening right now in my life and in my relationship? So absolutely.
Right. And all that information, again, I'll put that to the students after, but it's like Dr. Shannon Chavez, you'll find the full information links to contact you for consultation and booking, but I'll make sure I'll add that. Just wanted to make sure people know where to find you. And coming to some of the services or resources that you provide. So I love your website, by the way.
Thank
Um,
you.
so with the first one is if we can touch on premarital coaching. Do you mind talking a little bit about what that entails and when is a good time for someone to, is it when they're thinking about getting married? Is it as soon as they get the engagement ring? Is it just before the wedding night? When is a good time to maybe to approach you? And then with that, do you recommend people go individually or as couples?
All of the above, any stage. What's fascinating, I always tell this example. I had a young couple they were in the first couple of weeks of dating and they came to sex therapy. So I don't think it matters when, as long as you're coming with the intention of learning. So premarital coaching is, let's build a toolbox so you can go into this big stage in life. Marriage is a huge commitment and it's exciting, and I want people to get excited about marriage again. I think there's a lot of beliefs around, oh, intimacy gets complicated and what do we do? But this toolbox for coaching is all of the things that may be helpful in that first stage of marriage. Communication skills, how to negotiate and compromise what your needs are, sexual and not, just general relationship needs. How do we talk about the things that may come up? What are, maybe we're planning a family down the line. What are some of the things that we want to consider? So it's a toolbox, it's a place to answer questions. And I've worked with couples that are, right about that time to take their vows and get married, and others that are in the planning process. So I don't think it matters as long as you're coming willing to learn with lots of good questions. And it's a good gift to your relationship. I actually wish it was a requisite for any couple that was deciding to make the commitment of marriage, because it's useful. I know a lot of the first couple of years of marriage are the hardest for couples. I think there's this idea of a honeymoon phase, which I think comes way down the line in marriage. I think the first couple of years are really about adjustment, learning to live together, and all of those skills are really talked about in the premarital coaching. How do we cohabitate? How do we make sure that we're taking time for ourselves and each other? What's the advantage of doing things like date nights and sex nights? What are the things that might benefit from those? And what are other ways that we can make sure that we're making a habit out of bonding and intimacy in the relationship? So as you can see, I get really excited about this program. I think it's just important. I wish I had this before getting married, and I think that every, couple can benefit no matter where you're at.
Lovely. So that's actual program. So is it like set like blocks of like coaching sessions over a certain period of time, or is it negotiable? How does that work, the
Yeah, so
program?
I meet with the couple first, and I'll kind of do an assessment. What are our goals? What do we want to get out of this? And then I personally design that coaching program. So it might be 2 sessions for some couples, it might be 4 for others, it might be 1 for a couple that just sort of needs a couple of things to help them get started. So it's very personalized to the couple. There's no one program that's a one size fits for everyone. I really like to personalize a lot of my services. That way it feels like it's addressing what's going on for the individual and the couple. So it's not just a cookie cutter model. It really takes in all the things that we know and that are going to be beneficial for the couple. And we build a plan together, a framework, so that you're also not just ready with a bunch of tools and don't know where to go, but we really look at how to integrate and utilize these tools in the relationship right away. And we even do a lot of that in the session. So you learn we'll set up some role plays and communication in the session. So you're practicing and then taking it home, and you get to apply it in your relationship.
Lovely. And that premarital coaching program, is that also available online for international clients, or is it only in person?
Absolutely. So it's actually great to do virtually. So couples can kind of pop in and schedule a time. We have an assessment, we build a plan, and then we meet as needed, or we set up a schedule, a time where we learn and gain the skills and the knowledge that we want to, and then send the couple off. So yes, that's absolutely available for anyone, anywhere in the world.
No, that's great. So whether you are dating, whether you are
Yeah.
engaged, just about to get married, so you cater for all. So no, that's really good and important to know, just to clarify, because also one of the concerns that a number of women I've come across who are either dating or in a relationship or engaged is and I think you touched on about some of the expectations, and there's also like, how do I understand, how do I communicate in terms of what this person's expectations are in terms of intimacy, and also some misconceptions that I think a number of men have, especially in certain conservative Muslim communities around like the hymen and virginity and things like that. So is that also like conversations that you were having? Because I think a number of women that I've come across find that quite a difficult conversation to broach. So I'm just wondering, part of your premarital coaching program, would you be addressing such matters as well? Like that.
Absolutely. I mean, that's a big portion of it, is because that's where a lot of people are. I don't know how to communicate this, and I anticipate this being a concern, or how do we navigate that? So we absolutely will go through a scenario like that and talk through it. And a lot of my clients are conservative, and they're anticipating, fear and expectations. And so their idea of that first intimacy has already been shrouded with so much anxiety. And so we really break it down and we help the couple, go into that experience with confidence and knowing how to navigate what they need and to take care of each other rather than have expectations that are going to lead to other concerns down the line. I think that's such an important part of relationship, learning how to talk about it. And a lot of us just need permission. So that's why I think in these premarital coaching programs and other coaching programs, it's permission to not know the words to use, permission to not know where to start. And that's really what I'm here to do, is guide and be a referee sometimes and coach and really help, mediate and provide guidance in an approachable way. Because there's so much embarrassment if we feel like we don't know or we should know, or what words do I use? There's so many things that can block us and keep us from really the intention, which is connection. And we want healthy connection. That's what we're looking for. So I always tell people sex shouldn't be so serious. It's become this very serious, scary thing. And I really try to simplify it in ways where we look at, it's about relationships and building a relationship, whether it's with ourselves or with a partner. And yeah, we're kind of we're programmed for relationships. So it shouldn't feel overwhelming. If anything, let's make it simple and easy and approachable.
Oh, lovely. And actually, I did have another question in relation to the premarital coaching, because this was a message that I actually received recently, where a woman, recently married woman, no, sorry, a recently married man was complaining about his wife because she wasn't, obviously she was a virgin, not had any relations prior to their marriage, but he was surprised her reactions in the bedroom, because maybe he didn't say, but maybe what he had expected from what he'd seen and what he's heard, she wasn't making the noises in the face that he kind of expected. So he had a concern. So is that also, I'm just wondering, where does that from your experience come from? Is it, I don't want to just blame porn, or is it friends, or is it, where does that, because I hear that quite a lot. And then when I posted it on Instagram, I was getting so many messages from women saying the same thing, like this is a big issue. So I'm just wondering how in like the premarital coaching program, would that also be something that you kind of address, like in terms of these expectations, not only on the wedding night, that also in the first maybe couple of months or couple of years, not to have these unrealistic expectations that, forgive my language, that your wife will be like a porn star in the bedroom. That is what I've heard. So those expectations that some men have, is that also part of the premarital coaching program that you help um the partners understand?
Yes, because to your point, where do we get these ideas that this is what sex looks like, sounds like, should be like? And I think that comes from our lack of education. The fact that we only see sex in film or media and these very limited, narrow views of what sex really is. I mean, we don't even really see the relational part of sex. So in my coaching program, we're talking about not only how do we define sex, because I think that's always a question in every program and service that I offer. What we talking about when we're talking about sex? And also, how do we give feedback? How do we let our partners know when we enjoy something? And often I'll take it into non-sexual spaces first. So we'll talk about food. I talk about food and sex a lot because I feel like there's a lot of similarities in how we look at food and pleasure, whether it's things that we actually need for survival versus things that nourish us versus things that just make us feel good. So I think that, defining all of that helps. And I think there's a lot of gaps. What I find is that most people cannot answer that question.
Mm.
Well, intercourse is sex, or this is sex. And I'll really challenge them in a helpful way. What about kissing? What about this type of touching? What about other ways that we communicate, both verbally and non-verbally? So there's so much to learn. And I think that's important. And I find that even after a session or so of just learning and expanding a bit, we're able to see our relationships differently around sex. So it can happen very quickly with the right information, which is why I believe so much in education in this work.
Lovely. Thank you. Thank you for that. Now the next I'm gonna to make sure I pronounce this properly. Been practicing. The second resource, concierge therapy and coaching. So concierge, hopefully I pronounced that correctly. Concierge therapy. Do you mind explaining what that is and how does that differ from traditional therapy? And yeah, if you can just talk about what that entails, if you don't mind, please.
Yes, I get excited about this one too. So excuse me if I'm enthusiastic, but concierge really came, after the pandemic, I started thinking a lot about different ways to provide therapy. So virtual therapy became, very much the norm, and concierge to me takes it even a step further. It offers things like intensives, which have been really helpful for my couples work. So a couples intensive that's part of my concierge program may be 2 to 4 days of intensive full day therapy where we're doing a lot. It's almost like a mini workshop for a couple. So you're getting the process of therapy. We may do a lot of experiential work within that container for the couple. There may be a little bit of coaching and therapy in the concierge services. So really it's tailored to what the couple may need. Also, I go to the home of the couple for some of my concierge work. And the reason why I get excited about that is there's sometimes more of a home issue than there is a relationship issue when it comes to sex and intimacy. So I want to see the bedroom. What's going on there? What happens in this space? How do you feel in this space? So concierge work kind of allows me to pop into these spaces and be very experiential with clients, couples, and individuals, and see their space, see where they function. We may go to a remote space. Some of my concierge clients will go to a retreat space, have a little outdoor area, places that we can kind of have a different approach to therapy rather than coming into an office or being on a video call once a week. For some couples, they thrive in that environment. For others, we need to go a little bit deeper and a little more intensive. And I think that the concierge has really answered that and provided something that can be personalized and tailored for couples that may be in crisis or need a little bit more than the traditional therapy model.
Lovely, thank you. And from your experience, I know you mentioned you've have obviously a lot of experience with people from conservative backgrounds. So I'm just wondering, what are some of the common challenges that you found from, especially from people from conservative backgrounds in relation to sex and pleasure in particular, or female pleasure?
Yes, I would say the divide between their understanding of their spirituality and religious beliefs from sexuality, and the divide mainly being that they're on two opposite ends of the spectrum. So my job is to really bring an integration of those two. I feel that, like I mentioned, sexuality is so personal, spirituality is personal. Even if we all practice the same religious belief system, it's very personal in what that relationship is for you. And so for me, I take that seriously. Again, my family is very conservative, and religion means a lot to them. And so I want to first honor their belief system rather than, I think there's a lot of fear. If I'm going to sex therapy, I'm going to be told to watch porn or do things that are outside of my comfort zone. That couldn't be further from the truth. If anything, I want to meet the individual or couple where they're at. I want to understand those belief systems and how they're a part of their life. Because our religion or our spirituality is really about values, and values are a huge part about sexuality. It's also about how we live our life, what's important to us, what drives us, what motivates us. So to me, it seems like it would be almost impossible not to integrate that part of ourselves into our experience of sexuality, pleasure, relationship, and connection. So I think for conservative couples and individuals, I take it slow because I think it's also not about too much too soon. It's about building the relationship. It's about getting comfortable. I think there's, at least a session or two where there's a lot of embarrassment, but I love when I see that fade away with my work with my clients, where then they get comfortable with the language, talking about their bodies. I use a lot of teaching tools for my conservative clients, which may be vulva puppets or models, things that are going to be helpful to learn about sexuality, but that don't feel threatening, that don't feel overwhelming. And I work with so many different backgrounds, from different religious groups to different cultural groups to different age groups. So there's a lot to consider in terms of understanding, what that person's programming is like. What are the things that have impacted their understanding of sexuality? So that's, to me, the most fascinating part of working with conservative backgrounds, is that we want to honor that rather than make someone feel that there's something wrong with that in their life. and that's the block. Instead, we want to, see how we can get them to work together more efficiently.
Lovely, lovely. And retreats and workshops. I noticed again, me stalking your website, that you have done, or I'm not sure if you're going to still do some more retreats and workshops. How is that, those experiences of delivering or facilitating retreats in particular, how does that differ from the coaching and therapy? And also, do you have any retreats and workshops upcoming that maybe people might be interested in attending?
Yes, also something I get very enthusiastic about. My retreats and workshops, I get to kind of wear a different hat. I don't provide therapy in those settings. I really am there as an educator, as a co-facilitator, and a coach. And what is so exciting about doing retreats and workshops, I'll tell you about the last one I did. I had a group of Chinese sexologists who came here from China, and we had a translator, so we didn't even speak the same language, but we did an experiential workshop of vulva gazing. So we all of the participants were very brave. Again, all of these lovely women grew up in very conservative households, not a lot of sex ed. And we all got to vulva gaze. And vulva gazing includes looking at your own anatomy. Everyone got a pleasure pail. So in that pleasure pail, they learned about, lubricants and moisturizers. And so I look at these workshops as an opportunity to give you the things that you might not get from your gynecology office, you might not get in a therapy setting, but that are so integral to our understanding of our own pleasure. And, a lot of these women had never looked at themselves. They've never touched themselves. They don't self-stimulate. And the goal isn't to do all of those things. The goal is to get over the shame that we have around our bodies and the shame we have around pleasure and, permission for pleasure. And one thing I love about retreats and workshops is the power of healing in a circle. I mean, to get a group of 25, Chinese women together and heal in this way. I mean, everyone was terrified at first, and at the end, yelling, celebrating. It was just beautiful to watch. So to me, it's just one of the main reasons I do this work, just to see those moments of the shift that can happen in an afternoon of vulnerability and education. So to me, it's just a different way to reach different populations. And I know that, a lot of conservative populations may not be open to vulva gazing, but those that do can, heal, generations and generations of shame. It's remarkable to see what happens culturally when we provide a space for that to happen. So exciting work. I mean, it's definitely fun, and it's needed. I wish I could do retreats like this everywhere and anywhere, but as you can imagine, they're a bit harder to do based on, the environment and what people may assume is happening versus what is. It has to be a very sacred and safe space. So I don't have anything planned as of yet, but I am planning a workshop retreat maybe in the early of next year for women going through menopause, which is also a big part of my work now. Is, how do we help women embrace this big stage of their life, in fact, half of their life, and, learn how to, navigate the sexuality changes as well. So that will be coming soon, and I'll definitely send you some info when it's up and we're advertising.
But people should, and obviously I'll put the links, follow Dr. Shannon. Obviously I'll put her Instagram, Twitter, and obviously her website handles. But is the best place to keep up to date in terms of what's going on Instagram? Is that the best place, or your website? Is that, do you have like where's the best place to
Yeah,
have
I
mailing
would
list?
say social platforms, website. On my website, I have a contact form. So if anyone's interested, hey, I want to know about upcoming events, definitely email me, reach out. I'm happy to provide resources. And if I don't know anything going on at the moment, or if I don't have any, there's always something great happening in different communities, all over the world. So I at least can provide a network of where things may be and some options for some potential clients.
Lovely. I actually wanted to ask you, you mentioned, I noticed you mentioned about twice or three times about, you said permission to pleasure, permission to orgasm. What does that mean? What does that entail? If you don't mind.
permission, just honestly that, it's okay to talk about what feels good for you. It's okay to not know what we like. It's okay to not have the language. So, permission is really the first step, I believe, in sex therapy and coaching. So, that's usually where I meet people and build that rapport first, is just giving them a little permission. And why that's so important is most people have never heard those words. I know I never heard those words in my experience. So, I think it's important that people get permission when it comes to exploring their sexuality, because there's so much that we want to understand and learn, but so much we don't know. So permission helps us to find out what is our limited information. What are specific suggestions that might help when it comes to treating your concerns? So I think it's the most important part. And also it helps people give permission to others, whether it's your partner or social environment. It helps us heal and support one another when we learn how to give permission.
Amazing, amazing. And you, as you mentioned, you wear many hats: sex
Yes.
educator, psychologist, sex therapist, sex coach. Which of, and I know they somewhat overlap, but which of these hats are you more passionate about, if any?
Yes, I'd have to say educator, because there's so much we need to know, so much that we don't know, sometimes too much that we know that's not helping. So I think with educator, I get to reach people and allow them to build their awareness and understanding a bit more. And I think why I like educator too is that most people are maybe not in touch with what those sexual concerns are. They may not have a diagnosable problem, but they know that they're suffering. They know that they feel lost, that they may feel like they're the only one going through this. So what I find with education is it's so healing so fast. So just by getting reading a book or having a resource or learning some anatomy and physiology can do wonders. I mean, I've seen that. I've had people overcome vaginismus and sexual pain, have their first orgasm just through one workshop or retreat. So I know that it's not a miracle by any way, but it's information, it's education that we don't get, and how empowering that can be to learn something new, no matter where you're at in your life, and then go home and utilize it and overcome years of trauma and breakdown and feeling broken. I mean, especially my individual clients that have had vaginismus, which, as you know, is can sometimes be a very, challenging concern for many around sex. And so to see such fast progress to me is, I wish everyone was educating. I wish that's really my biggest goal, is that we have education more accessible for everyone, no matter where you're at in the world.
Lovely. Sorry, do you mind explaining what vaginismus is? Because I'm sure people do want to hear from an expert. So do you mind
Yes.
explaining vaginismus is?
Absolutely. So vaginismus is a sexual concern that has a both psychological and physiological component. What it can actually cause is a lot of sexual pain and discomfort. So there's an involuntary contraction of vaginal muscles. So it can make it very difficult or painful for penetration. And usually there's a component where the pelvic floor muscles can be very tight, and there are many things that can cause vaginismus. Sometimes it is a tight pelvic floor, it can be trauma, it can be just fear around sex, which is why education is important. If I'm fearing that something's going to hurt or feel bad, then my body is going to respond to that fear distress. So it's a very common concern, I think, as well. Again, one of those scary terms that is very, very common. And there are a lot of different ways that we can treat it. And sometimes it's more psychological than it is physical, and vice versa. It really depends on the individual case. But the good news is there are a lot of different ways to treat it. So if you've tried one thing and it didn't work, don't give up. There are many different ways. It may be more psychological than it is physical. So it is good to get a good assessment. And usually what I'll do in my practice is, if the individual believes they have vaginismus, we get a medical rule out. So we will recommend a specialist just to make sure there's nothing there that I wouldn't be able to treat on a more psychological basis. So for example, sometimes there can be inflammation or a perforated hymen or something blocking entry that might need a more surgical or medical intervention. But for the most part, it's really about learning your anatomy and pelvic floor, and doing exercises and mind body exercises and tools that can help alleviate it. And I've seen just tremendous progress with individuals doing both, using more of a mind-body approach.
Amazing, amazing. And again, just to reiterate, so people are aware, because vaginismus is a common concern that I often hear about. So, like you mentioned, especially for someone who may be a woman who might be suffering from a, is it a psychological perspective, you can treat that, and that's part of your services that you offer. So, is that part of the, is that the therapy, or is that part of the coaching umbrella?
Yes, it can actually be both depending on the issue. So if the individual has not done any work around vaginismus and they may be starting for the first time, I would definitely recommend to go more of the therapy route. That way we are getting a little bit of all of the above. So we are going to go back in history and understand, where this comes from, be able to understand some of the body programming around it, and be able to work then in an approach that addresses both what we're telling ourselves, because any pain disorder around sex is going to affect our nervous system and our thought processes. So we want to look at everything for how long have you been coping? What have you been working on and trying, and what has worked well, what hasn't worked so well? And I would say definitely therapy. It's that way we have all components covered in the process.
Right. And also, do you help if, for example, if a woman who is she's had relationships before but always has a fear towards intercourse or penetrative intercourse in particular. So she doesn't have vaginismus itself, but just the fear of penetration is something that she's always worried about. Is that a
Mhm.
separate condition, or is that part of vaginismus, or is that, just wondering, is there a name for that? Like someone who's got a fear of intercourse, and is that something that you could also treat?
Yes, great question. I mean, sometimes they get clumped into one category. So I'll have individuals that say, I have vaginismus, but as we start to assess further, it may not be that. It might be more of a phobia. And that's sort of what you're describing, sort of a fear or anticipating something, or sometimes it's the idea of something. So I've met individuals that have developed a phobia from a pelvic exam and developed a vaginismus condition. So it's not always connected to intercourse, but the idea of any entry of any object creates a lot of fear and distress. So I treat it like a phobia. We may work on desensitization and in vitro settings so that we can actually use visualization and tools to break down that fear response and create a different association with penetration. And this is where education comes in helpful too. So most individuals have never even seen an anatomical figure of what intercourse looks like, whether it's penetration with the finger or genitals or an object. So we'll look at that. I have these really great visuals and animations where we'll show, if something were to enter, what does it come in contact with? What different body parts? If we were to move the hips in different directions, how does that change the way in which your body feels? And so we kind of walk through all of that together so that the individual has a better understanding, and that helps the fear quite a bit. So then, okay, it's not this thing that's going to hurt me, or that I don't have any control over. Oh, I can position myself differently so that it's more comfortable for my body. Oh, adequate lubrication really helps that reduction of discomfort. So a lot of that is, basic education that we're just not receiving. And we go over it very simply, even lubricant, if a provider says, well, use some lube. For most of my clients, what does that even mean? What kind of lube? How do you use lube? So we walk through every step of the way. So we may even in session, let's put a little on our hand. Let's look at how we would use it. We talk about things like massage first. So you're really embodied and getting into your embodiment so that you're able to then be prepared for any sort of penetration or sexual activity. So that's also just a misconception with lack of education, that your body is ready to go. And if it's not, and if it hurts or I'm not lubricated, then something's wrong with me, rather than understanding, it takes a minimum of 20 minutes for most women to get physiologically aroused. So just that fact alone is so healing for many of my clients. What? Okay, I thought I was just taking too long. Or, okay, that makes sense that I'm not ready right away. And what are the things that can help with that readiness? So I think those facts are so healing for so many women.
Lovely. Just before we wrap up, just a couple of quick, because I've got to mention, for because we spoke a lot about premarital coaching and the concierge therapy. I just thought one other cluster of concerns that I get in relation to women who are struggling with low libido, low desire. Is that something that also you can help with? Is that from a therapy perspective or a coaching perspective? And the second part, sorry, I know it's kind of two questions in one, is for women who are maybe struggling with their bodies after having a child, they're struggling to connect with their partner. Is that also something that you can help with?
Absolutely. I mean, those are probably my most three common concerns that females come in with, postpartum, low libido, low desire, and then also just body image issues. I mean, it's rampant. There's so many concerns. So absolutely. And again, it's an assessment. We really look at, talking about, for example, if we're looking at low libido, low desire, a lot of education there too. What does that really mean? What is libido versus desire? What is one versus the other? Most people think it's like a drive or a switch, and if it's off, what am I doing wrong? And rather than understanding how desire works. So I think that a lot of education in that area. I do, I may recommend books like Emily Nagowski's Come As You Are, and research to help validate and understand the experience. And then I think when it comes to body image, that's also something that we look at, programming and messaging. Because a lot of I always tell people we're not born hating our bodies. And you probably didn't develop these body image issues just recently as an adult, but they're probably coming out a lot more. And when we do some therapy around this, we find that there's a lot of, generational messaging around the body, especially in our culture, whether we were told to cover our bodies or feel shameful around our bodies. So I think therapy can be very effective for going into body image concerns. What were the things that you grew up hearing about your body? Some of the barriers that we have around just touching and being with our bodies. So very common concerns. And also for males as well. I know we tend to think of females as being primarily the ones with body image issues, but a lot of my male clients are struggling with body image, and especially today's society where we see, over sexualized images or body ideals that are not accurate, or over filters and all these things that are impacting how we feel, and we don't see normalized bodies very much. Even in film, we hardly see sexual bodies that are natural bodies. So that creates a lot of misconception and perception for people, and they struggle with that. So I think that coming in to do this work, we start to peel back those layers, but also start reprogramming. And I feel very strongly about reprogramming with, finding the source of the problem, but then replacing those sources with things that are going to feel more empowering for you, and learning to have a good relationship with your body. And I think it's the longest relationship we have in life, and probably our most abusive relationship. And it needs a lot of healing, our relationship with our bodies. So, don't have any shame if you have body image issues. We all go through it. I even disclose myself. I myself have gone through these issues. It's not uncommon. If anything, I like to disclose some of that as a professional, just to normalize the fact that, we all go through this, and it's, not something that needs to be stigmatized, or that we feel like we're just a statistic. And I think that does such a disservice in sexual healing.
Oh, I agree. We're all human. It's all part of the human experience. I do agree. I do. But that's absolutely amazing. Thank
Exactly.
you, thank you, thank you, thank you, thank you very much, Dr. Shannon. It's been an absolute pleasure. So you are on behalf of the Erotology Institute, our go-to sex therapist, licensed psychologist, sexual health experts, and obviously from personal, now again, a big fan of your work. And yeah, absolute pleasure to have you on board. And again, I'll make sure I want to put all of your details to our students, clients after, so people can contact you if they need a consultation, to know about your different services, both therapy, coaching, and educational services, as well as
Yes.
your retreat. So, and again, obviously, please follow Dr. Shannon on social media, on Instagram, Twitter, and obviously, like I said, if you need any therapy or coaching or education, she's cited everywhere. If you just Google her name, she's been on Cosmopolitan, Men's Health, Women's Health, to name a few Los Angeles Times. So she's very well experienced and and a lot of experience across different cultures. And
Yes.
even because I came across your research that you did many years ago about sexuality amongst I think American Muslim women. So that was really useful for me as well, part of my research. But it's been absolute pleasure, Dr. Shannon, and really happy to have people like you on board because whilst there are a number of um, sex therapists and sex coaches, there are not many that I feel like yourself who can speak to people of different cultures, backgrounds, and of different ages. Like I loved your episode on Logan Paul's impulsive. So that's how I know you can relate to different generations as well. So
Oh,
you
yes.
yeah,
Yes.
so did a great job there as well. So so no,
Yes,
honestly,
just spreading the word. I mean, it's such a big part of the work that I do. That's why I love, any opportunity to reach people wherever you are. It doesn't matter. I mean, I've had clients come to me from Egypt, from remote places all around the world, Pakistan. So I get it. Everyone's experience is different, but finding someone that is compassionate and that can help you heal and guide you is the most important thing. So I always recommend for everyone out there, shop around, talk to different therapists. I myself offer a complimentary consultation because I feel like we have questions when we're thinking about any service. And so I actually talk with people that are interested and we go over, what's the difference between therapy and coaching? What would it look like for me? How many sessions? All the things that we might be curious about and, really trying to find a good fit. I think that's such an important part about the success of your work in sex therapy or coaching is not how much training has the person had, all of these things, that's important, but it's also the relationship that you can build and building that collaboration through the process and making sure that you're, getting the most out of it and hopefully having a little bit of fun and not, it's not too painful of a process, but definitely, talk to different people, see what approaches are out there. And like you said, everyone works differently and there's, someone out there for everyone.
I agree. I've got to mention and your YouTube page. You've got a YouTube page, right? Got to mention
Yes,
that
I
to
do.
plug
I'm
that in.
starting to do more YouTube videos because I think I love YouTube myself. I always access YouTube, so it's a little bit harder with the censorship going on, as you probably know, as a content creator as well. It's we're up against a lot of censorship around sexuality, but that shouldn't stop any of us from putting the word out and making our message be heard. So yes, definitely check out YouTube. I've got some great videos there, lots of stuff on relationships and just tips on how to improve who you are in your sexual health.
Lovely. And I'll put a link again to your YouTube page or channel again now. Sorry, I forgot about that. But again, thank you, Dr. Shannon. It's been an absolute pleasure. Thank you.
Thank you again. Thanks so much for having me.